Hello, everyone, and greetings to you from Colorado. My name is Katie Bullock, and joining me today is my colleague, Hayley Nelson. And today we are going to be talking to you about inspired philanthropy through grateful patient and faculty partnerships. We are from the University of Colorado Anschutz Medical Campus. And before we begin, we would love to just tell you a little bit about ourselves. I am a Senior Director of Development for CU Anschutz Medical Campus, originally from Columbus, Ohio. And my role at the medical campus is connecting benefactors with their passions to advance medicine. And I believe that everything that is done in the world is done by hope, by the wonderful Martin Luther King.
Hi, everyone. My name is Hayley Nelson, and I serve as an Associate Director of Development at CU Anschutz. And in my role, I serve as an Internal Director of Development and work alongside our faculty on their visions and grateful patient fundraising. I'm originally from the Twin Cities area in Minnesota, and I believe that philanthropy is about improving the world and not money.
So Hayley and I have three objectives today that we'd like to part with you. First, we want to discuss why strengthening your own faculty partnerships is key to having a successful grateful patient program. We would then also like to share some best practices about leveraging your faculty relationships into meaningful gift conversations for patients and for their families. And then lastly, we'll share a patient success story that is using a benefactor-centric approach that is specific and unique to grateful patients. So who we are, again, we are the University of Colorado Anschutz Medical Campus. And on that campus, it's the UC Health University of Colorado Hospital. The UC Health Hospital is ranked #1 in Colorado and is the largest health center in the Rocky Mountain region and is the hub for all care as well as specialty care.
Like Katie said, we are the largest academic center in the Rocky Mountain region, often bringing patients from surrounding states. Our CU Cancer Center is the only NCI designated comprehensive cancer center in Colorado and the entire Rocky Mountain region. And one thing that makes CU Anschutz really unique is we encompass Children's Hospital of Colorado, the Veterans Affairs Medical Center, UC Health University of Colorado Hospital, and the medical academic campus, all in one spot. So that allows for really diverse research and cross collaboration between faculty partners and patients.
So now that you know a little bit about who we are, we want to start by talking about, before anything else, what is a grateful patient and really the definition. So if you take nothing else from our presentation today, which we hope is not the case, but we want you to take away this point that the patient's experience is the #1 most important thing. A patient cannot be grateful until they've had really a high quality, seamless experience from start to finish with their physician, their whole care team, before they can really even become grateful. So that is the first thing we wanted to make sure was very clear. When we talk about grateful patients, we cannot assume that they are grateful unless they've had those things in place. And again, we also have to earn the right to have these conversations to begin with. So the strong connection between their physician and their care team is absolutely key for grateful patient fundraising. And then off to the right, I just wanted to point out this is our philanthropic revenue statistic, but I did take a quick look at national averages and actually found one from 2008 from AHP that was about 85% individuals or grateful patients, and with the remainder being non-grateful patients, we're about 80%. But as you can see, that's a very, very large part of the pie. So grateful patient fundraising is extremely, extremely important to academic medical institutions and hospitals. So we're going to be also talking a lot about benefactor-centric. We operate in a benefactor-centric model in which the benefactor always comes first, and their care, again, their experience, beating a dead horse here, but is the most important thing. Because of that, this tends to be more of a compassion-based relationship with our benefactors. And for many, many people, philanthropy can be a part of the healing process in their journey. And our medical campus is structured in that we are all generalists. The fundraisers on our team do not have assigned areas. So we understand that is very different from some places where the development officer is assigned breast cancer or Alzheimer's. We are doing wherever the benefactor wants to go. And we believe that also makes us more benefactor focused. And then the other thing that I just wanted to point out about our model that we acknowledge is also very different is that we split the development officers into two different positions. So Hayley, for example, is an internal development officer, and she's working solely with faculty. And then myself as an external development officer, I am working solely with benefactors. And we feel that if you are just having one person do both, then you absolutely must have equal attention to both benefactors and your faculty, because really it is the best way to build a robust grateful patient program. I'm going to kick it off to Hayley to dive into some faculty work.
Great, thank you, Katie. So I'm going to talk a little bit about our axioms, or what we see as the guiding principles in our work. The first one being that we believe that philanthropic funds should be spent purposefully and as a finite resource. So when I'm working with faculty, I spend a lot of time talking to them about how benefactors really entrust in them to spend their money as it was intended. And we found that benefactors and patients really love to hear the impact of their giving, and that's where the joy comes from. So that's one thing that we really put a lot of time and focus on. The second being 95% of our revenue comes from 5% of our benefactors. So we definitely operate as a major gift shop, and we found that our highest ROI is in campaigns of one. And really what that means is our strategy for philanthropy is working with our faculty partners to identify who are those 2 to 3 people and patients that you see that have had a really great seamless experience like Katie talked about, and also have the inclination to move the needle in the work. And so we really focus on campaigns of one rather than casting a wide net. With that being said, we do have a colleague that runs a patient engagement program that's focused on cultivating patients and really bringing in those first-time benefactors. We also are data-driven in our decision-making. And so I'll talk a little bit more about this later on in the presentation. But really what that means is we'll show some data about how having strong faculty partnerships and building that trust can lead to warmer referrals that we make and hand off to our external development officers. So next I'm going to talk a little bit about, so what does this partnership with faculty look like? This really starts with meeting with the department chairs and division heads to learn what is their division or what is their vision for their area. And so learning from them, what are their research and goals, and where are those opportunities that philanthropy can help move the needle in the work. I would even recommend asking those leaders, who are those rock stars in your division or department that you want me leaning in with? Whose research should I be learning about? How can we move the needle in your area? And then it's really about identifying potential benefactors for outreach. And this is definitely a mutual partnership. So working with faculty to make sure that they're comfortable with the approach. And I'll talk a little bit more about the different strategies that we use when engaging with patients. But we found it's really important to make sure that we're always lockstep with faculty and making sure that we're communicating with them throughout the whole process and that we're on the same page, because as Katie mentioned, the physician and patient relationship is really sacred. And so we definitely want to be respectful of that throughout the whole process. Lastly, partnering with faculty and setting those standard meetings. So we found a lot of success having face-to-face meetings. This can vary on the frequency depending on the faculty member, but we have a lot of faculty we'll meet biannually with or quarterly with. in our virtual world with COVID, we've had to move to Zoom, as I'm sure all of you have, and we found great success and think this has actually opened a lot of doors because faculty may be hopping on a call from the OR. We found that we've been able to engage with benefactors over Zoom. Katie's going to share some of her successes later on, but we've seen some great opportunities there. And then how do we fuel these warm patient referrals? As Katie mentioned, we have an internal development officer team and then also our external development officers. So I really work with those faculty to identify who are those patients and then make the handoff to our external team. This really starts with looking at a list of patients, and we call this a patient panel. Essentially what it is, it's a data set that will pull in patients, for instance, over the last year of a physician and look at things like different things like real estate, public stock, if they've given philanthropically, and it will generate this list of people that we think have the most capacity. With that being said, we always lean on our faculty members because at the end of the day, they're really the ones that have the relationships with the patients. And we really look to them to say, who are those patients that can move the needle in the work? Secondly, it's really important to work with your faculty and understand where are those funding gaps and opportunities that philanthropy could help fill. We really try to have large visions and inspire our benefactors up. And so Katie will talk a little bit about how we inspire benefactors with visions. And so having a clear understanding of how philanthropy can help move the needle in the work is important. And as I talked about before, making sure faculty are comfortable with the strategy that was talked about and the approach. This can look really different depending on the faculty member. So some faculty members are really comfortable talking to their patients, and they may even say something in clinic like, you know, you've been so grateful. Would you ever be interested in learning more about my research and what I do outside of clinic? We've also found that faculty members prefer for us to take the lead and have those philanthropic conversations, and that's okay. It's finding out how we can work with our faculty members and make sure it feels good for them. And lastly, we've seen a lot of success utilizing divisions heads and department chairs. So leaning in with those leaders and seeing if they're open to doing outreach on behalf of their faculty members is another great opportunity. We wanted to provide an example of, you know, some language that we might use when we're talking with our faculty partners about philanthropy. So this says, we want this to be meaningful for benefactors. And we found that if it is an impactful experience for them filled with joy, they will want to give again. You don't need to be the one asking for money. We will just be asking for your input so we can inspire patients to give. And I think this really highlights how faculty members can take a step out of that philanthropic conversation. And really, we're just leaning on them to help inspire patients and move the needle in their work. Another thing we found a lot of success in is helping coaching faculty to their responses when patients express gratitude or an interest in philanthropy. Oftentimes physicians may say, oh, this is just my job. This is what I do. It's nothing. And really working with them to acknowledge the patient and the benefactor and say, thank you. It was my pleasure. Would you be interested in learning more about our research efforts outside of clinic? Some other examples that faculty could use are clinical trials are often made possible because of philanthropic support from families like yours, or even having an introduction to our office and saying, may I introduce you to a colleague in the advancement office? And that's a really nice personal introduction to our office. So how did we get to, these partnerships, and how does this lead to our, our data-driven decision-making that we talked about earlier? So this is really looking at our office's patient referrals that we've received from faculty members. And you'll see down below that we have a GP letter, which is a grateful patient letter that's sent via mail that opens the door for a philanthropic conversation. An event or tour, so this could be patients coming to campus for something as like a lab tour, a different event, and then a personal introduction from a faculty member. And you can see how a personal introduction from a faculty member leads to much higher rates for personal visits, proposals, and gift conversations. And so this really highlights that, how important having that trust with those faculty members can lead to more fruitful conversations with benefactors.
Thank you so much, Haley, for talking about your internal faculty work. So I will now dive into really the art and also the science of grateful patient fundraising with benefactors. You can think of the art as really the philosophy of our work and the science of the how, the logistics of how we do the work. But the art of the work is really tied intrinsically to our office's values and to our culture, which we find very important. So here are really kind of our top four philosophies that we also consider just critical to our work. We believe that meaning should come before money. So what that means is you're talking about, what you want to do and what inspires you versus what amount are you trying to give for to fund what object or what project. Having meaning come before money is just going to create a joy-based conversation. And we also believe that it should be permission-based versus surprise philanthropy, if you will. So what that means is asking questions, which I ask oftentimes, questions like, I don't want to assume anything, or with your permission, could we have a conversation about what your philanthropic goals are versus show up and throw up is a funny, strange jargon in our fundraising world that you may have heard before, where you have a menu and you really want to talk about the priorities of the hospital and of the research area versus really just showing up and listening and asking for permission to explore the areas that they have an interest in. And then we also believe that opportunities should be presented and not needs. So if you're presenting needs, then you can be really seen as a needy organization. And needy organizations don't really inspire benefactors to give significant contributions. Saying we have an opportunity and we want to partner with you inspires them so much more than having a need-based organization. And then opportunities also really lends itself very well into the next point, which is that we are vision-based versus being in the weeds. So what that means is we show them a big picture of where we want to go, the very, the big goals of the department or the area you're discussing, versus we need a microscope so that we can hire staff so that we can do this research project. And by the way, the goal is to become a better center. And oftentimes that big vision is buried in there when you should really start with, we have a vision to become the destination ovarian cancer center in the country. And we would love to hear about how you'd like to be a part of that. But sharing the whole vision is just, I think, a respectful thing to do, and it brings the benefactor in at the level that they are comfortable with. And for this last one to really work, you really, really do need to have a very strong relationship with your faculty partners and your hospital partners in order for that to work. So now on to the science part. So aside from the number one takeaway that we said earlier of, really grateful patients and how they become grateful, I think the number two most important takeaway here is strong faculty partnerships. So those relationships are going to create warm referrals and very seamless partnerships with our faculty and with benefactors, as Haley really got into with her slides. The various tactics that we use really help create these warm referrals. And then high impact engagement. This is moving conversations forward regardless of the vehicle. And we have found that in these virtual times we're in, high impact engagement is really critical to moving gift conversations forward. We've also found that varying your outreach is also important. So not always just emailing people, even just not only calling people, switching it up, sending a really nice thank you note in the mail, handwritten, is very rare these days. People are home more these days, so pick up the phone and call them. You're way more likely to have a really substantial phone conversation these days. then maybe you are scheduling a visit, which it is kind of all over the place right now, and some are not even doing that still. So, and then the last point for this slide is your donor cycle, thinking about doing all of your donor cycle points virtually. So again, as a quick refresher, that would be identification, qualification, cultivation, solicitation, and stewardship. And again, being comfortable and prepared to do all of these virtually. And just as an example, in 2020, almost all of my gift conversations were from phone calls. And then a little bit more about the science. These first 2 points are, again, I think very specific to grateful patient fundraising. It's just more personal. You know, you're hearing from vulnerabilities, the vulnerabilities of the benefactor, who is most likely the patient or a family member of a patient who has successfully gone through a treatment or has unfortunately passed from the treatment. So you are just so much more closely tied to their situation. So it's going to be more personal. Being comfortable with that and embracing that is really just going to enhance your relationship. We've also seen that in these COVID times, you're sharing your vulnerabilities about COVID. And so that has, strangely enough, I think, made our relationships with our benefactors closer. And then meaningful outreach versus just outreach. So instead of just asking for that next visit or asking for a gift, you're really cultivating the benefactor and creating strong partnerships by sending an article of an area of research that they're interested in or that they've given to, or an article on their physician about their area of interest, and saying, I thought of this, I thought of you when I saw this. Or even just picking up the phone and saying, how are you doing, you know, with this Delta variant? We've been thinking about you. That's going to really make you stand out as an organization, reaching out when so many other organizations that are oftentimes seen as maybe needy are reaching out and asking for more gifts. And you're really making your outreach meaningful. It's going to make a difference. And then increased portfolio management. That just means really taking the time to think about who your top donors are to your institution and what are some of the strategies that you can create to move them along towards a gift, towards a stronger relationship, more engaged with your hospital, et cetera. And then the last point here is just everything is faster. We have found in grateful patient fundraising, decisions are made quicker. And I think because they're more personal and because philanthropy can be a part of the healing process, things move so much faster than, let's say, higher ed, for instance. So making sure you're comfortable with that pace, and especially for stewardship, making sure your stewardship is faster as well. So for example, once a gift is made, immediately dropping a handwritten note or picking up the phone and calling them, having the faculty that's, you know, that's appointed to the research or that they have a passion for doing the same thing, thanking them immediately. And then, as Hayley said, it's so much easier in these virtual times to set up a Zoom visit with a faculty member that has a very busy schedule because of the virtual times. And so let's take advantage of that. And we have seen that really work wonders to connect that way with someone that's giving to their work. And now we are on to our success story. So taking all of these principles and putting them into place, we wanted to share an example of a patient story of a benefactor who gave right in the middle of COVID. This was in June of 2020. Hayley's going to start by talking about kind of what was in place before the person made their gift.
Thanks, Katie. So really this started, as we talked about, with the patient receiving excellent patient care and having a great relationship with the physician, and then trust being built with our office and the faculty member to identify that this patient was really grateful. This was also their first gift to CU Anschutz, which was really great. And then Katie's going to talk a little bit about, you know, what did those touch points look like, even in our virtual world, and where things are at now.
Yeah, so talk about just a successful, very warm referral. I mean, once this was kind of passed along to me to reach out to the benefactor after my initial phone call, where again it was a very substantial phone call. I would say just as important as if I had met him individually in person. 6 days after that call, he had verbally committed to $25,000. So that just shows how seamless everything should be in place, and then that it really does make conversations easier. And then they shared that they would like to continue giving. And then 6 weeks after their first gift, they did make another gift of $10,000, and have since shared that they have an interest in doing some six-figure giving, and have also since identified another interest area and given to that area. So they are really leaning in with our campus. It's really wonderful to work with them and to see their engagement and to see how excited they are about what's happening on our campus. And we actually have not met until about 2 weeks ago, is the first in-person visit we've had. And they have since given $75,000 to us. And so again, this just echoes that virtually our work can completely be done just as it was pre-COVID. And then just to get into the math a little bit of this, we looked into kind of the number of touch points between our first 4 months of working with this person, and there were 21 touch points, which one can say is a lot. If it's the right amount of outreach and meaningful, it's not a lot. These were varied between emails, phone calls, and handwritten thank you notes and things like that. And I would say half of those touch points were stewardship focused touch points. So then the fun thing to look at is that it was 6 weeks between his first and his second gift. And these touch points, I think, really did come into play in the trust building and the excitement of giving to the campus. So that concludes our presentation. We just want to thank you all for joining us today, and we appreciate your time.
Thank you all so much for tuning in, and here are our social media handles. So please check out CU Anschutz and reach out to Katie and I if you have any follow-up questions.
And also don't forget to rate the session on the virtual conference platform. Thank you.